Welcome to the Committee on Financial Matters seminar providing state group health insurance benefit updates for 2020. My name is Jack Sorensen. I'm co-chair of the Committee on Financial Matters and Retirement. Kay Ryder-Crone was the co-chair on this committee, or this presentation. Wanted to let you know that we have some other presentations coming up this fall. October 16th, Howard Erlanger will be here for Estate Planning 101, The Essentials. November 13th, both of these at 10 a.m. Ken Wondrow will be back, and this time his talk will not only include the tax law changes, but will include tax cuts, tariffs, and treaties. I should also mention that any of you who would be interested or looking for something to volunteer that's worthwhile, CFMR or other UW Retirement Association committees could always use volunteers, and we'd welcome your participation. There is a place to sign up on the bottom of the evaluation, and we encourage you to give it some consideration. By way of ground rules, this afternoon's presentation will proceed without questions other than those to clarify a statement that was made by one of the speakers. We will do the Q&A session in bulk at the end. The presentation itself is being recorded for the website, and the Q&A session will not be recorded. So just to let you know, we aren't looking for your questions until after the fact unless you need a point of clarification. This afternoon's talk will feature program managers from various components of your state group health programs, and we expect that you will enjoy their presentations. It's a little more detailed than we've been in past years, but that's a good sign, I hope. Okay, it's my pleasure at this point in the afternoon to introduce Ms. Eileen Mallow, Director of ETF's Office of Strategic Health Policy. Amongst Eileen's many accomplishments, she does have a Bachelor of Science degree from the UW-Madison. Eileen has been Director of the Office of Strategic Health Policy since April 2018. Immediately prior to that appointment, she served as the Deputy Director since October 2015. Over that time, as we all know, there have been significant changes to the ETF state health programs, for which Ms. Mallow played a major role. Prior to ETF, Ms. Mallow had also served in the Wisconsin office of the Commissioner of Insurance in several capacities: the Assistant Deputy Director, Insurance Commissioner, Director of the State Health Insurance High-Risk Health Insurance Pool, and as a Program and Planning Analyst. Eileen also worked as a Compliance Manager and Privacy Officer for the Physicians Plus Insurance Corporation. I now welcome Eileen Mallow. Thank you.
Hello, everybody. So I always get tired when people read my bio. So I'm here to talk with several of our staff about the changes to the health program for the upcoming year. There was a significant change last year with the addition of the United Healthcare Medicare Advantage plan, and we will talk a little bit about how that went. I think generally good, but we're here to just take any questions, feedback you might have. Just as a starter, the staff that I have with me includes Molly Heisterkamp, who's our wellness manager. She was specifically requested, so we brought her along. Arlene Larson, who you've seen before, who's the manager of our health programs and was instrumental in standing up the Medicare Advantage plan. Tricia Sig, who's a relatively new addition to OSHIP. She's part of what we refer to as the class of 2018, where we added 4 people on the same day. It was a lot, out of a staff of 15, yep. And I also have with me Brian Stamm, who's the newly added Deputy Director of the Office of Strategic Health Policy. So that's our staff, obviously more back at the ranch, but that's who we brought with us this time. Many of you remember Tara Prey, who's been here several years in a row. Unfortunately, Tara is leaving us at the end of this week, and she decided to stay back and make sure that her desk was ready to go. So we will miss her. She brought a lot to the team. So in terms of what we're going to talk about today, we're going to talk a little bit about the Group Insurance Board. The Group Insurance Board, most of the people who are members of the Group Insurance Board are directly or indirectly appointed by the governor. So as you can imagine, with a change in governors, we've had a significant change in the board. Right now, there's 10 of the 11 seats are filled. There's one vacant position that we're still waiting for. The good news is the chair, whose name is Herschel Day, he's a professor of actuarial science at UW-Eau Claire, is a carryover from the previous board, has a really good background. 3 of the 10 members were previously part of the board, and then we have 7 new members, and as you can imagine, it's not easy to get up to speed on what we do and what this board does. But you can always see anything about the board is posted on the ETF website. We're also going to talk about health plan changes. We're going to talk about how the pharmacy and medical plans have changed over the last year. Not a lot, but we want to talk about it. Molly's going to talk about Well Wisconsin and how you can take advantage of what's offered under Well Wisconsin. Tricia will be here to talk about the dental program and some new additions in our supplemental dental program, which we think people will like. And then we're also, if we have time at the end, going to talk about some new videos that we've done to help educate members about what the program does, what it doesn't do. We have a nice video about how to get health care in a hurry if you need it. Encourage you to not use the emergency room unless it's really an emergency. So, some major changes, and I think the first one isn't going to affect this group a lot, but it does, if you live up in the northern part of the state, have an impact because Security Health Plan left our program starting the first of the year. It was their decision to leave, and they had 2 service areas, and they will not be part of the program. The thing to note is on the bottom chart, the bottom right-hand side, you can see that 97% of the providers who are currently available with Security are available with a new health plan for next year. So, Dean Health Plan and Dean Purveyor 360 added several counties for next year. Good news, if you have Dean, you'll be able to access some of those services outside of Madison. I'm not going to spend a lot of time on this. We at Trust East added a significantly number of new counties for next year. Also good for people who live a little bit east of us, but certainly some space there. And then some changes in the benefits themselves. So right now, if you need a vaccine for any of the services on the right side, which is the traditional vaccines, you only we're able to get them at your physician off your clinic, from your doctor. For next year, you'll be able to go to a pharmacy and get them. And these are the vaccines, pretty typical ones that you might want to get. I know the shingles vaccine has caused a lot of questions. We understand the supply is increasing, but you will still be able to get it at your pharmacy and rather than having to go to your doctor's office. If you need other vaccines, they would still be subject to the same coinsurance deductibles, cost sharing we would have in our plan right now. I think mostly of travel vaccines that people might want that are not covered by this part of it. The important thing is to remember to bring your Navitus card, but it should be $0 copay for those. One of the new medical benefits that we added, excuse me, for next year is bariatric surgery. There are some specific criteria. You have to have a BMI of 35 or above. Generally, it would be something that would be subject to a decision by your health plan. They're going to be looking for comorbid conditions such as heart disease, maybe some orthopedic issues or diabetes as a way to help you. We would expect that most health plans will have you go through, if you want to take advantage of this benefit, an extensive process where they evaluate your overall health condition and move forward after that. And if you are interested in it, you should talk to your health plan about what their specific criteria are because we let their medical professionals make the decision, kind of not in our scope of what we can do. We don't have any medical professionals on our staff, but it is available for next year. Another important thing is if you had an FSA with Task, who's our current FSA vendor, their contract ends at the end of this year, and we offered, and the contract has been transferred to a new vendor called Connect Your Care, starting the first of the year. I think the most important takeaway for this group is that if you have an HSA with Task, you need to move it to the new vendor, or you're going to be assessed a $3 copay or a $3 administrative fee every month going forward, starting the first of the year. The nice thing about Connect Your Care is they do have more investment options for people who want to use their HSA option. Then we're going to talk about Medicare program changes, and Arlene's going to come up and talk.
All right. Yeah. All right, and I'm going to take the wand.
Yeah.
Hi, I'm Arlene Larson. It's good to be back. And I'm here to talk today about some Medicare program changes, both with Medicare Advantage, a new Medicare Sum option, and a new Medicare Life event. So first off, last year we had quite a long discussion about Medicare Advantage. And as you know, right now it's only available if you are either a single retiree on Medicare or you and all of your dependents have Medicare. And we got a lot of feedback because members who had a spouse who was under Medicare age were like, you know, I'd really like to have Medicare Advantage because it's more affordable and it's got this nationwide network. And so we went back and we were able to accomplish that. But first, before we start talking about that, I wanted to let you know some statistics. So for 2019, 4,300 retirees enrolled in Medicare Advantage, and they cover 6,500 members. So that's subscribers and dependents. UHC reports customer service satisfaction at 97%. And last year we talked a lot about primary care physicians. I know some people in the audience were saying, okay, I'm with GHC South Central. Am I going to have problems seeing them in 2019? There was a lot of work that went into that during It's Your Choice. And we haven't heard hardly any complaints. I was talking to ETF's ombuds people the other day, and they're like, you know, for a first-year plan, it's been remarkably well received. So that's good news. It seems like GHC providers are seeing Medicare Advantage people, and there's been no pushback. If you've got individual circumstances you'd like to talk about, I'm going to be around during break and afterwards, so feel free to catch me. The other PCP issue that we had last year was about Dean. Some people had PCPs who were going to retire. And they were concerned that when that PCP retired, if they didn't have, that they would be dropped down to the bottom of the list and somebody else would get a PCP before they did. Again, that did not materialize. We haven't heard any complaints. People have been able to see their Dean docs and get new PCPs. So I'm happy to report that. Okay, so this Medicare Sum, and this is for retirees where at least one person has Medicare and at least one does not. That's the definition of a Medicare Sum. We used to call them Medicare Family 1. You might remember that from the It's Your Choice book. Well, the good news that I'm happy to report is after a year, we were able to give you 3 options. So the first option is what we currently do, where everybody's insured by one health plan, but you get different benefits, whether you're on Medicare, where Medicare pays primary and we pick up almost everything after that, or not. But new now for 2020 is you can select 2 health plans. So the first option, which a lot of people are interested in, is Medicare Advantage for the Medicare people and any other health plan for the others. And then the third option is Medicare Plus, offered by WEA, and that's the worldwide Medicare supplement, so the benefits are a little different than uniform benefits, but it's worldwide coverage. And then again, Medicare Plus and any other health plan. For those of you who currently have Medicare Plus, your dependent has the Access plan if they're not on Medicare. That will continue to be offered. That's under the single plan option. This is new, where it's Medicare Plus and anything else. So this is kind of a different visual representation of that to help you see graphically that the Medicare person, you as a subscriber get to fill out a paper application and say, I either want Medicare Plus or Medicare Advantage for me, and I want Dean, Quartz, WEA East for my dependents. Okay, and then you'll notice on this slide it says other It's Your Choice health plan, and what that means is all non-Medicare health plans provided in our program. Okay, why did we do this? Well, we heard you. Last year there were a lot of people who came to us everywhere we went saying, you know, please can you make this available, and we were able to accomplish that. So now you've got more flexibility, you'll have some lower premium rates. By the way, books were dropped in the mail yesterday. They are not sent first class. So those, some of you will start to receive them pretty quickly this week, but other people it may be into next week when you finally get it. And then you'll see premium costs for Medicare people are going down this year. Overall, there was a 4% rate increase. However, that's the average of state actives versus retirees versus grads, and Medicare retirees are seeing a decrease in premiums, which is great news. And remember, Medicare Advantage has nationwide providers, including the US territories, and Medicare Plus is worldwide. Dental. So right now, you know that you get to choose whether or not you want uniform dental coverage. With these new Medicare Sum programs or plans where you have 2 health plans, everybody has to either have dental or not have dental. We just wanted to make that clear. Another thing that we got requested last year was, okay, I'm an early retiree. I'm not yet 65. I'm going to turn 65 in June, and I want to be able to change health plans to take advantage of lower premium rates when I hit Medicare. Can I do that? And you could not until now in 2020. That's another change that we made with the help of the Group Insurance Board. And so now, for those people, when you enroll in Part A and or B, so on the left you'll see enroll in both or enroll in just B or just A, that will give you an opportunity to change health plans. So then you'll just send us an application. On the right you see loss of A or B. Well, when does that happen? This is very uncommon, and usually it's when you've got a person who goes out on a disability retirement, they have end-stage renal disease, they get Medicare, and then they have a kidney transplant, and they're cured. So then they lose B. So that's when that applies. Okay. When can you do this? You need to send in your application to change plans within 30 days of the date that you get A and or B. Now, when you're under age 65, you know you've got a 3-month run-up before you get your Medicare. You can send in your application early, but don't send it in late. So 30 days is the window. You'll notice there's a footnote there on retirees should have both A and B if they're eligible. Every year, unfortunately, there are a few people who think that it's going to save them money if they drop Part B. And then this is a bad idea. And the reason it's a bad idea is because our contract says that if you don't have Part B, you will be responsible for the claims that Medicare would have paid if you had had B. So that's 80% of your doctor's visits. And so we want to continue to spread the word of if you're eligible for A and or B and you're retired, get B. If you're not retired, don't get B. Okay. All right. So now the next question is, what happens when I have this Medicare Family Sum contract and my non-Medicare dependent gets Medicare? Well, they automatically are enrolled in the other health plan. So right now what happens is that if me and my retired husband have Dean and I turn 65 and I roll onto that, I get the Medicare benefit automatically. Now for next year, actually I'm going to go back. Under this new Medicare Sum where you've got 2 health plans, the non-Medicare people will be automatically transferred to either Medicare Advantage or Medicare Plus, whatever the subscriber chose. And then if that's the last person who is eligible for Medicare, then your contract becomes a Medicare Family All. We used to call that Medicare Family 2. We think this language is a little more understandable. Okay, and then remember, when that person gets Medicare, whether it's your dependent or you, they could change health plans. So if you decide, no, we don't want to be with Medicare Plus anymore or Medicare Advantage anymore, you can file an application within 30 days to change that. Okay, and now I'm going to turn it over to Molly.
Thank you. All right, good afternoon, everyone. Hope you're doing okay, hanging in there with us. There's a lot of great information that we're sharing. I'm really happy to be here with you all to share a little bit more information on the Well Wisconsin program, the State Group Health Program's Wellness and Disease Management Program that is available to our members. So I will be reviewing just a high level of what that program is. some of the results that we've been seeing with the program to date, and then share a few final program reminders as we're nearing our 2019 incentive deadline. We'll talk about the 2020 program changes, and then I wanted to also remind all of you about a new program that we're piloting called It's Your Health Diabetes. So that's just a little preview of what I will be covering. So at a high level, Well Wisconsin is designed to improve member health and well-being through education and activities that support a healthy lifestyle. It is part of the total health management model, helping to support members either before medical encounter or in between those medical encounters with the healthcare system. The goals are to reach participation levels of 40% by 2022, which is the last possible year that we will have our first contract with Staywell, who's currently our program administrator. We want to reach and maintain high satisfaction rates of 90% or higher, which I'm really pleased to be able to report that we have been seeing statistics in these numbers and above. And we also want to continue to decrease health risks by a minimum of 1% on an annual basis. So this slide here presents just a few of our data points after the completion of our full second year under the Staywell administration of the program. So you can see it did start the incentive back in 2013 via the health plans. So they were administering in 13, 14, 15, and 16. 17 was the first year that Staywell came on board, so you can see that jump in the green bars in both 17 and then another little nice bump in 2018. What I'm really excited to show is that for those participants who were in both 17 and 18, there was a 2% reduction in health risks for those repeat participants, which is phenomenal to see. Furthermore, if members participated in health coaching, there was a 10% reduction in their health risks. So that equates to dollars saved down the road, right? Because if we're helping to improve our health status, hopefully it can prevent some medical encounters in the hospital or at the doctor's office and things of that nature. So there is still time for members to participate in the program for 2019. While the services are available through the end of the year, for example, health coaching around lifestyle factors or disease management, or utilizing the wellness portal to access various wellness challenges, educational content, recipes, etc. The incentive deadline is October 11th. So there are 3 activities toward earning the $150 gift card. It does include a health screening, which can be completed at on-site events around the state. Many of them are housed at employers, but ETF does also sponsor additional on-site screening events at some of the area hotels or convention centers like Monona Terrace or the Clarion Suites right on Rimrock Road. However, we acknowledge that a lot of people are already up to date on their preventive care, and that's phenomenal. That's what we want. We want people to be getting their preventive exams at their doctor's offices and having those relationships. So instead of participating in one of those on-site screenings where you have your blood drawn, members can submit a healthcare provider form, and that was what was provided to you as you walked in here today, in case if you want to participate yet before the incentive deadline. So you may fill that form out yourself, utilizing data from your most recent doctor's office visit, and then you may submit that via mail, postal mail. You can fax it. Yeah, those are the 2 options, mailing it in or faxing it, or you can scan it. There is a 3rd option via the portal. The second activity is a health assessment. This is a questionnaire. It is available on the Staywell website, or if you're not into creating a new portal account or having something online, you may participate via paper. You can call the Staywell helpline and request to have this paper health assessment mailed to your home address, fill it out, and send it back in. The 3rd activity is a well-being activity. There's a variety of different options here that you may choose from. They do range from things such as health coaching, as I previously have mentioned, or things like the Million Steps Challenge or educational videos. Please note that our legal counsel has deemed any wellness incentives as taxable income. So most of our members who are actively employed, all of them, when they earn an incentive, their employer deducts those taxes via payroll. Since all of you are not receiving an actual paycheck from an employer, obviously you're getting an annuity, but we're not able to deduct from that annuity, so that's why we are now taking your personal responsibility for those income taxes out of the gift card prior to it being issued to you. So that's why you'll see that Well Wisconsin gift card issued to you in a lesser amount. I believe it's a $136 if I'm recalling off the top of my head. Also want to note that if you are not creating your online account and you don't want to do that, and you're filling out that healthcare provider form and doing that paper health assessment, that well-being activity may be waived for you, since if you're not using the website to be able to complete those. Another note, since UHC Medicare Advantage members are receiving incentives via UHC for completing activities like the health screening via UHC, that you cannot also receive the incentive via Stay Well. Do want to note that if you participate in the Well Wisconsin program, all of your data is kept private and confidential. The only individual level information that is shared back with ETF is if you earned an incentive amount and what that amount is. Obviously, it would be the same for all retirees, so that ETF may issue the W-2 at the end of the year. Stay Well does abide by HIPAA, GINA, the ADA, as well as they have their privacy statement out there and available for you to be able to review. You may call and request it from them if you would like, or it is on the bottom of their landing page. So new for 2020, Stay Well is enhancing their online presence with their web portal. So all participants will need to create a new portal account to be able to check that out and engage in the new activities that are available. Something that's really exciting is currently if you're using the online website to get your incentive, complete the activities, and then you go out and request to have the gift card emailed to you, and you can use it virtually on online marketplaces, or you request to get that physical gift card mailed to your home address. New for 2020 is you complete your activities, that gift card is automatically going to be sent to you. You do not have to choose to get it emailed or physically sent. Everybody will get the physical gift card. There will no longer be that option. So I think people will enjoy not having to go through that step of getting that gift card. Some new features of the new portal includes a variety of health trackers for individuals who are wanting to focus in on improving their health status and tracking how they're doing in different topic areas. For example, tracking how many glasses of water you're drinking, if that's something that you're personally wanting to focus on, your sleep, or servings of fruits and vegetables, for example, minutes of exercise, meditation, etc. There will also be a really great guided meditation app for those individuals who are wanting to hone in on their meditation skills. There's a lot of different settings that you can have. This 360-degree view. If you are using the apps, you can move your phone around and it'll actually show you as if you're in a forest, for example, and you can see around you as you're going through the meditation. As a note to meditation has been scientifically researched, there is scientific benefits to practicing meditation and mindfulness. There will also be virtual coaching. So as I mentioned with the health coaching, currently you can have a phone call with your health coach. New next year, you can actually have an appointment with your health coach on a computer screen in front of you where you can see them. And it's like you're having a one-on-one conversation where you can actually see their facial expressions and have a little bit of a deeper relationship that way. Or else you can chat with a health coach online. There's also the ability to chat with a doctor and have answers questions questions answered from licensed physicians around the country, fitness videos, and if you're into social connection with others who are utilizing the platform, to be able to chat with others like you. Obviously, continuing for 2020 is the incentive for completing similar types of activities as now. The one-on-one health coaching and disease management will continue to be available, and the website will still be the same to be able to access information. It's Your Health Diabetes. If you have been diagnosed with diabetes, you may see reduced prescription drug copays on your anti-diabetic drugs. All you have to do is connect with a Stay Well disease management health coach. They'll help you with managing your condition, and you'll see these reductions in your copays at the pharmacy. So you can call Stay Well if you're interested in enrolling in that program. And this slide here does include Stay Well's helpline, their phone number or their email address. Their hours are indicated here, and they'll certainly get back to you as soon as they can. So thank you all for your time. I appreciate it, and we'll be turning it off to Tricia.
Good afternoon. My name is Tricia Segan. I've never used a wireless mic in my life. So if I mess it up, forgive me, I apologize. I am the supplemental plans manager at ETF. Supplemental plans include the dental, both the UDB, Uniform Dental Benefit, and the supplemental plans. So I'm here to talk today about how you can take care of your teeth. So for 2020, we have a change to the supplemental plan program. You'll see the Uniform Dental Benefit, which you get with your insurance through ETF, is still there. But we heard from members who wanted there to be a plan similar to the Uniform Dental Benefit that was available to people who didn't have health insurance through ETF. So we've created the preventive plan. The preventive plan is exactly the same as the Uniform Dental Benefit. There is no difference. It covers the same thing. It covers fillings, cleanings, exams. I point at my teeth a lot through this presentation. It's just a habit. I apologize. So it covers the same thing as the Uniform Dental Benefit. The only thing that's different is you pay a little bit more for it because it's not through the health insurance. And also the two other plans that cover the major catastrophes, the crowns, the bridges, those things, the Select plan, the Select Plus plan remain from 2019 to 2020. So Delta Dental has two different networks. They have the PPO network and the Premier network. So the PPO network is a slightly smaller network, and is only taken, if you have the Select plan, you can only go to dentists in the PPO network. If you have the Uniform Dental Benefit, the Preventative Dental Benefit, or the Select Plus plan, you can see all of Delta's dentists, which are about 90% of dentists in Wisconsin. And then if you travel outside of Wisconsin too, these networks exist. So if you go to Arizona, Texas, Florida, they're all there too. You can just go on Delta's website and look up where the providers are. So a little bit more about the Uniform Dental Benefit. Like I said, you get it if you get your health insurance through Wisconsin, through the ETF. Retirees can opt out of it. Coverage matches your health insurance. So if you have family health insurance, you're gonna have family Uniform Dental. If you have single health insurance, you're gonna have single Uniform Dental Benefit. If you currently have the Uniform Dental Benefit and you're going to have it for 2020, you're not going to get a new card in the mail. You're just going to continue to use the same card. However, if you transition from being an active employee to a retiree, you will get a new card because you change groups. That's the only difference. So this is what the Uniform Dental Benefit covers. Like I said, it's in both networks, both the PPO and the Premier networks. It's $1,000 maximum, no deductibles, no waiting periods, and it covers your teeth, your fillings, everything like that, the diagnostic, the preventive services. And then if you have somebody who is 19 or under on your plan and they need orthodontics, this covers an additional $1,500 for their orthodontics. So for the three new supplemental plans, the one supplemental plan and the two continuing, the preventive plan, which is new in 2020, the Select plan and the Select Plus plan. Again, the preventative plan is just like the uniform dental benefit. I told our member services team, we're gonna get t-shirts that say that. It is the same thing, it's the same exact coverage. And again, available to retirees that are not enrolled in the health insurance under the state group health insurance program. Covers the same thing as the UDB, all the same things. So this is the price. So the price for the uniform dental benefit and the preventive plan are the same. So the only difference is if you are on Medicare 1 or 2 through the UDB, the family rate is a little bit different. So I can't tell you what to do, but if I was on state health insurance and I was gonna get the uniform dental benefit, I get the uniform dental benefit, not the preventative plan, because you're gonna save $60. It'll be slightly less money. But again, your life, live it like how you want. So the select plan, which is the plan that has the slightly smaller network, is limited to seeing the dentist only in that PPO network. It has $1,000 individual annual maximum, and it covers your major crowns, bridges, everything at 50%, and does not include any orthodontics. The Select Plus plan, which is a bigger benefit, which is also then means more money. You can see any dentist Delta covers, which is 9 out of 10 in Wisconsin. It has a $2,500 individual maximum premium, and it covers things 60 to 80%. It includes $1,500 in ortho for anybody of any age, for children up to however old. So if you have both the Select Plus plan and the UDB or the preventative plan, you'd have have a child who needs dentist, that would be $3,000 in orthodontics it would cover. So what everyone wants to know is the price. So here's the price for 2020. It will also be the price for 2021. And then I put in there what the price difference is over 2019. You'll notice the price went up slightly for all of the plans. Actually, I just put that in there so you have it as a handout. This is kind of not a great slide. This here breaks down all the plans of what everything is covered. It compares. So whatever's covered in the uniform dental benefit and the preventative plan is not covered under the Select or the Select Plus plan, and vice versa. So if you want to enroll, you can enroll during It's Your Choice, which starts next Monday. You can go to ETF's website, where we'll have the retiree enrollment form that you can download and mail into Delta, which is up in Stevens Point. You can go to Delta's website, the address is right there, and you can register through their website, or again, print off the application and email it in, or send it in rather, mail it. If you do become a new subscriber, you're gonna get an ID card and a welcome letter from Delta sometime around December 15th. And then your new coverage would start on January 1st. Thank you. Oh. Say one more time. You have to enroll even if you already have it this year? No, you don't have to re-enroll. Only if you're going to make a change do you have to enroll. So whatever you have now, you're great with, it'll keep going. Just realize that if it's a supplemental plan, you're going to pay a little bit more money. Okay.
Great. And so I'm just back up here again briefly to share a little bit more information on some really good resources that ETF has been working on to help educate all of our members on some of the different program options that are available. So right here are a few that I will be touching upon. So some of you may have noticed that ETF has released a new website. So it's the same address, etf.wi.gov. But when you get there, you'll see it looks a little bit different than it used to in the past. So this was just recently released within the last couple of months. Up at the top, you'll see this banner that helps you know right away where you want to go to. Do you want to go to learn more about your benefits, or do you want to go and learn more about education, about some of the different program benefits to you? I feel like I keep cutting out. So to get to some new videos that I want to reference today, when you go to the website, you'll go to Member Education and click on Videos. Within there, you'll be able to scroll down and see all the different options that are available. One that I wanted to take time to show you all is our new video on getting medical care when you need it fast. So when something comes up, you aren't expecting it, what is your best option for receiving care?
Trying to figure out where to get medical care when you need it fast? In this video by the Department of Employee Trust Funds, we'll discuss which option is best, depending on your situation. What if you get a sore throat on vacation? Or your child wakes up with an earache? Telehealth is a great option. It's available anytime from the comfort of your home or hotel room. No crowded waiting rooms. And it's fast. Telehealth usually takes 30 minutes or less. And it's easy on the wallet because it's free for most participants. A provider will review your symptoms and prescribe medicine if needed. Don't worry if you're away from home. There are in-network pharmacies across the U.S. Telehealth can even be used for things you might not expect, like bronchitis, strep throat, bladder infections, and rashes. Sometimes you don't know if you need to go into the doctor's office. Say your child is running a fever or has a nagging cough. That's where a nurse line can really help you out. A nurse line is a free service that connects you with a nurse anytime. A nurse will help you decide if there are treatments you can do at home, symptoms to watch for, or if you need in-person care. Other times, you know you need in-person care. When you need care right away, you might think you have to go to urgent care, but did you know? Often you can make a same-day appointment at your doctor's office because of cancellations. It may not be with your doctor, but it could be with someone on their team. Why take the time to make an appointment? There are a lot of benefits. First, you cut your time in the waiting room. Sometimes urgent care can have a long wait. Your wallet will appreciate it, as your doctor's office is less expensive than urgent care. The doctor will have full access to your medical history and, if needed, could refer you to a specialist easier. Your doctor's office is more likely to follow up and make sure everything is okay afterwards. Things don't always come up during office hours. If it's not something that can be handled using telehealth or the nurse line, then your next best option is urgent care. Urgent care is open evenings and weekends. Typically, no appointment needed. You will be covered while you're on vacation if your need is urgent, but make sure to let your health plan know to help the payment process go smoothly. You may be surprised. Urgent care can help you with broken bones and stitches if the injury isn't severe. This saves you money because urgent care is less expensive than the ER. The emergency room is there to handle life-threatening illnesses and injuries, such as a head or eye injury, chest pain, shortness of breath, slurred speech, or seizures. This also includes your mental health. If you are having suicidal thoughts, head in. Now that you know your options for receiving care, it's time to get prepared. Take 5 minutes to work through our Get Ready for Care worksheet and print out the Get Medical Care When You Need It Fast handout. Stick them on your fridge so you and your family are prepared when you need care fast.
All right. So I think just to highlight, one of the new things that a lot of members aren't aware of yet is that telehealth service offering. So if you do have something when you're out traveling or you're at home and you just don't feel like getting yourself into the doctor's office, telehealth is a really great option for you to consider. And again, it is a $0 copay with using that for most of you. Yeah, so the question is, she had a family member visiting who was not on her health plan, and her family member was able to leverage a telehealth service to be able to receive some care and advice. And so the question is, through these telehealth offerings, can it be for anybody, or do you have to be on the health plan? That really is going to be dependent upon the telehealth provider. Some of them may have it open to anybody, but others may be just for their specific members. So over here, this one handout, the telehealth information, is a really nice one because it provides the information on how to access your telehealth service via your health plan. So I recommend that you all have that information readily available, and you could always call your health plan's customer service line to ask, hey, if I have a family member visiting, would they be able to also leverage this service? A lot of times they might, but it will be a fee for that person, but it likely is pretty minimal as compared to going to urgent care or the emergency room. I don't know, Arlene or Eileen would. Okay. There's a little bit of a mix. Some of them are from clinics and some of them are from health plans, but all of the health plans have to be able to provide the information for you to be able to help direct you to how to get telehealth for you. Okay. So we'll take more questions again at the end. All right. There's another video out if you go to that the same website under member education, under videos for your health benefits in retirement. This is a nice overview of how your benefits work. You're outside of your health plan's coverage area. I'm not going to play it for you all today. The key takeaways are that no matter where you are, if you have an emergency or an urgent care situation come up, you may visit the nearest location and that would be covered for you. And prescriptions can also be covered anywhere. You would just want to make sure that it's a covered pharmacy under the Navitus network. There's also a video on if you're approaching age 65 or approaching Medicare, providing a bit more information and education about what you can expect as you come into that retirement age. And then, I don't know if you all have heard about Alex, ETF new virtual benefit counselor. We heard from members that they wish there was information on there for Medicare members, so that is new this year, that you can go on out and get support in helping you decide what type of health plan might be best for you, which options. So Alex, just a little bit more information, is interactive, personalized benefits decision-making tool. It does focus on medical benefits, dental, and additional supplemental benefits. It is a helpful virtual-based counselor. It'll ask you questions that you can go ahead and add your answers specific related to how many members are on your plan that you'd be covering, what your anticipated health care needs would be in the upcoming year, and things of that nature. So based on your answers to the questions, it will modify the type of results and further interaction that you'll receive from this benefits counselor. Members who have used it really feel more empowered and educated on the decisions that they are making. It does speak in plain language, no jargon. It, again, is highly interactive, personalized, feels like you're having a real conversation, and it can be accessed anytime, anywhere. And really importantly, it's totally anonymous. So nothing of what you're submitting in there are tracked, and they don't know who you are. It's on this website that anybody can access. Yep, so again, via the ETF website. So this is the new website. Based on the size of your screen, it may look a little bit different, but what's really great is this search function. Very quickly, you could just type in Alex. That would be your easiest way to get to the benefits counselor, and here you can go on in and access the different information. So I'll go in. We have a couple of minutes. I'll do a little sneak peek for you all. This is the actual, where's the sneak peek? Thank you. So this is a sneak peek. Where I was going is how you actually would access it to help you go through the full benefits session. This is just a short little video that gives you a little preview. almost knew all of that already because we already gave you the preview over the last hour. That's just a little video that helps for those who don't have this opportunity to have somebody come in and be able to review all of the changes. But again, to get to Alex, I may have gone through that too quickly, so just to review it again for you. Once you go to the ETF main page, just click on the search button and type in Alex, and you can go to Meet Alex, your interactive benefits counselor. And this is just a little preview explanation of it, and then down here is where you can actually get started. So you would select, coming retirees from the UW, you would select this one right here. Not for UW system, these are for active UW employees that are currently getting a paycheck from them. All right. And that is it for us. Thank you on behalf of my team for your time, and we look forward to your questions, but I'll turn it back over to Jack.
Thank you very much. We can take a 10-minute break if anyone is interested. Everybody want to sit and just start with the Q&A section? That'd be great.